Hello everyone, my name's Dave Sr., and today my friends and I will be explaining the exceptionality of visual impairment. Visual impairment is a term used to describe any kind of non-correctable vision loss, whether it's complete blindness or partial vision loss. A person's experience of visual impairment depends on many different factors that we will discuss in this video. Along with my good friends Jeanette, Heather, and Ryan, we will prepare you as teachers to accommodate a student with visual impairment exceptionality. First, Heather is going to discuss the diagnosis of visual impairment in children.
Thanks, Dave. Hello, everyone. As always, medical professionals are included in the diagnosis process. These professionals would include an ophthalmologist, who is a medical doctor that performs eye surgery and diagnoses and treats all eye diseases. An optometrist is an eye care professional who provides vision care ranging from sight testing and correction to the diagnosis, treatment, and management of vision changes. A pediatrician manages the health of a child as they develop, and in some rare instances, a specialist may be brought in by the medical team. Children who have family members with vision impairment should be examined throughout their childhood. If a student in high school has not already been diagnosed with vision impairment, here are some signs you should look for. The student closes or covers one eye. They squint their eyes or frown while reading. The student complains that things are blurry or difficult to see. The student has trouble reading. They hold objects close to their eyes. The student blinks more than usual. Or they become frustrated when doing close-up work. In some cases, they have red, watery eyes. Visual impairment diagnosis always begins with complete patient history and a family history by the medical professionals. This is followed by an external examination of the eye. I'll now pass it over to Jeanette, who will detail the tests used to diagnose visual impairment.
Thank you, Heather. As for most tests, the ones that measure visual impairment also measure visual acuteness. You may be familiar with the first test that we are going to examine.
The Snellen test is also known as the visual acuity test. The patient is asked to read the letters with each eye separately and then both together. Ability to read the letters at each size determines the visual acuity. The score is made up of two numbers. The first number represents how far away from the chart the patient was when he or she was able to successfully read the letters on the chart. The second number represents how far away a person with healthy vision should be able to read the chart. Healthy vision is 6 out of 6.
Another test used to diagnose vision impairment is called a vision field test. Vision field is the range of vision our eye can see without tilting or turning our head side to side. This measures the peripheral vision of our eyes.
The test uses a device affixed over the patient's eyes. Lights are flashed on and off in the patient's peripheral vision. The patient is asked to press a button every time they see a light. Any gap in their field of vision is detected. A tonometry test uses specialized instruments to determine fluid pressure inside the eye to evaluate for glaucoma. An ocular motility assessment tests if there's squinting or other problems in the movement of the eyeballs.
As Dave mentioned before, there are many factors that can lead to visual impairment. I'm now going to pass things over to Ryan to discuss the many causes of visual impairment.
Thank you, Jeanette. That was very informative. So now I'm going to be going over the etiology, or in other terms, the cause of the exceptionality of visual impairment. And to start, we're going to talk about the physical eye conditions. Glaucoma is a condition that damages the optic nerve, which transmits information from the brain to the eye. Macular degeneration is the damage to the portion of the eye that allows it to functionally view detail. Cataracts cause the effect of cloudy vision and most commonly occur in older adults. A person with amblyopia or lazy eye has their sight still intact, but will be hindered in their ability to see detail. Long-term effect can lead to even further vision loss without proper treatment. This is the same with someone who has strabismus or cross-eyed. Optic neuritis is inflammation causing temporary or even potential permanent vision loss. Retinitis pigmentosa is damage to the retina and most often does not lead to blindness but may cause vision impairment. If a tumor attacks the retina or optic nerve, it may cause blindness or vision impairment. So next we will look at other scenarios not directly connected to the physical eye conditions, but rather scenarios that can result in vision impairment or vision loss. People who are more susceptible to vision impairment are people with eye diseases such as macular degeneration and glaucoma, people undergoing eye surgery, people with diabetes, people who suffer a stroke, people who work with or near sharp objects or toxic chemicals, people who sustain eye or brain damage, and premature babies or those with birth defects. Among children, the causes of vision impairment vary considerably from country to country due to availability of prevention and treatment intervention. Dave's going to talk about the prevalence of vision impairment. Take it away, Dave.
Cheers, Ryan. Before we look at the numbers and my fancy charts, I want to break down the global leading causes of vision impairment.
The leading cause of visual impairment is unaddressed refractive error. This can cause moderate to severe distance vision impairment or even blindness. A refractive error means that the shape of your eye does not bend light correctly, resulting in a blurred image. The four types of refractive error are myopia or nearsightedness, hyperopia or farsightedness, presbyopia or the loss of near vision with age, and astigmatism, resulting in distorted vision. The second global leading cause of visual impairment are cataracts, which are the opacification of the lenses of the eye, which leads to a decrease in vision and can affect one or both eyes. As Ryan mentioned earlier, macular degeneration happens when the small center portion of your retina, called the macula, wears down, causing blurred or no vision in the center of the visual field. Glaucoma is a group of eye conditions that damage the optic nerve, the health of which is vital for good vision. This damage is often caused by the abnormally high pressure in the eye. Diabetic retinopathy is a diabetes complication that affects the eyes, caused by damage to the blood vessels of the retina, the light-sensitive tissue at the back of the eye. Corneal opacity occurs when the cornea becomes scarred, which stops light from passing through the cornea to the retina. The cornea is the transparent structure of the front of the eyeball, and corneal opacity may cause the cornea to appear white or clouded over. Trachoma is an infectious disease caused by the bacterium Chlamydia trachomatis. The infection causes a roughening of the inner surface of the eyelids. This roughening can lead to pain in the eyes, breaking of the outer surface or cornea of the eyes, and eventual blindness.
Globally, 1 billion people have vision impairment that could have been prevented or has yet to be addressed.
This is a chart of the global cases of visual impairment in the world. As you can see, 123.7 million individuals worldwide have moderate or severe distance of vision impairment or blindness due to unaddressed refractive error. 65.2 million have cataracts, 7.8 million have macular degeneration, 6.9 million have glaucoma, 4.2 million have corneal opacities, 3 million have diabetic retinopathy, and 2 million have trachoma. As you can see, unaddressed refractive error is the highest visual impairment factor of them all.
I'm going to pass it back to Ryan, who will share some interesting facts about the prevalence of visual impairment. Ryan?
Thank you, Dave. Countries can vary as to the leading causes of vision impairment amongst children. For example, in low income countries, the leading cause of vision impairment is congenital cataracts, whereas in middle income countries, the leading cause is most likely to be retinopathy of prematurity. People who are designated as low or middle income are 4 times higher to become vision impaired compared to those that are in high income regions. 285 million people are vision impaired, with 35 million of them being legally blind. People 50 years of age or older make up 82% of blind people. Globally, 1 billion people have impairment that could have been prevented or have yet to address their conditions. If a doctor determines that you have a eye condition that is likely to result in visual impairment, there are many treatments available. Jeanette will cover the prognosis options for visual impairment.
Really great facts, Ryan. Something to think about for sure. Common prognosis options could be eyeglasses, contacts, eye drops, and even some forms of medicine. In extreme cases, surgery might even be required.
For instance, cataracts are often treated by removing the clouded lens and replacing it with an intraocular lens, which is an artificial plastic lens that requires no special care and restores vision. Other methods can compensate for vision loss. Guide dogs can help people get from place to place independently. Braille allows those with visual impairment to read and write. Special equipment such as microscopic or telescopic glasses and voice recognition software can make school and homework easier. In certain cases where a person loses vision due to illness, some vision may return, but some may not. Multiple sclerosis is an autoimmune disease, and one of the markers is lesions on the brain. In some cases, an MS attack can be very debilitating and affect many parts of the body, including a person's eyes. In a very severe attack, a woman lost her vision at 36 years old. She now sees only shapes and no details. After months of recovering, this woman has regained little vision in both eyes, but very little vision in her peripheral. The prognosis in her case is unknown, as when dealing with matters of the brain, we do not know how quickly, if at all, it can recover.
Another example of returning vision would be a person who suffers from ocular migraines. In this case, vision loss can occur. However, the prognosis is good because the vision can quickly be restored after medical intervention. There are some amazing resources and a lot of information in regards to vision impairment. My dear friend Heather will now take over in a segment we like to call Resources and Information.
Thank you, Jeanette, and welcome to the resources and information segment of our presentation. I'd like to start by talking about the website, Paths to Literacy, which has many resources posted and shared for those with hearing and visual impairments. This website contains resources such as links to assistive technology vendors, apps, webinar links and dates, schools for the visually impaired, Braille for beginners, Braille song videos, Braille to text links, and so much more. THATS, which stands for Touch and Hear Assistive Learning System, is a great app to create an international community and support system for the visually impaired, and a fun way to share and learn. THAT's objective is to improve the educational process for visually impaired people. THATS is an encyclopedia of images and audio tracks with information about interesting images to help better prepare the visually impaired for the educational system. This helps train visually impaired according to their needs, which results in more job opportunities. Anyone can contribute with educational materials using THAT's edit module, and visually impaired people can study topics of interest using the read module. Another great resource is Bollyland Magic Plus. It's an app from Sono Kids. It is designed to teach the foundation of gesture skills and voiceover accessibility by learning through music, games, and shows. The American Foundation for the Blind houses the Helen Keller Archive, which is full of lesson plans for middle school and high school students. Blind Droid Wallet was created to help the visually impaired identify the currency and value of money. TapTapSee app was created to help users to identify objects. This has been Resources and Information. Dave is now going to wrap things up by detailing some differentiated instruction and accommodations for students with a visual impairment exceptionality.
Thank you, Heather. As always, the most important thing is that we meet the educational needs of our students, and a student with visual impairment exceptionality is no exception.
These needs may include the reduction in distance from the board or teacher, assistance in moving around, auditory cues, or magnification of images, and ideally a consistent living environment.
Having educational strategies in place is important when creating differentiated instruction for students with special needs. These can include
Strategic seating so the student can hear you. Printed notes so the student can read it up close. A highly structured and organized environment. Accessible resources in consistent locations. Keeping the setup of the room unchanged day to day. Having an orientation and mobility, or O&M, instructor available. Instituting the buddy system with good communication, a loud voice, and good directional vocabulary, a must. And probably the most important of all, classroom accommodations.
classroom accommodations for students with visual impairment exceptionality are crucial, and a large part of their success will be consistency in the environment. Accommodations can be made in many ways.
Keep the floor space clear. Practice early dismissal to allow time for transitions, accompanied by a peer buddy or O&M instructor. Always address students by their names so the visually impaired person knows who you're talking to. Announce who is talking or presenting. Have a set seating plan. Organize materials and workspaces. Clear pathways. Be consistent with the pattern of teacher movement. Review emergency procedures. Use high contrast paper, pens, and colors. Use enlarged print. Use talk-to-type programs. Offer preferential seating. In a perfect world, utilize a resource service library for large print, braille, and auditory materials.
I'm here with an educational assistant speaking about the accommodations she has in place for a student with vision impairment.
Right. I work with a student who is blind. He has been blind since a very early age. He is also hard of hearing. He wears hearing aids, and he is an English as a second language learner. It is very important that I get the work beforehand so that I'm able to preview it and make any modifications, accommodations, materials that this student would need for the instructional time. We use things like the desk in front of him, his phone, his binder to talk about what is perimeter. We used a tactile ruler to measure. If they were smaller numbers, he was able to do that mental math. If they were larger numbers, he has a talking calculator. This student likes to braille the questions, so he would braille the measurements that he could refer back to in order to do the calculations and then braille his answer. Because he is not seeing numbers, he does require the practice for place value because he'll get mixed up, for example, with 160 and 106. It's important for him to keep practicing those skills.
All of these educational strategies and accommodations are detailed on our exceptionality handout, which is available on the discussion board. If you would like a PDF of the handout, please reach out to myself or one of my amazing group members and we'll email you a copy. Before we say goodbye, we'd like to go over our references as they have been so helpful to us and we would love to share them with you.
WordPress is full of fascinating and informative peer-reviewed articles. I suggest everyone check out the Individual Needs and Diversity Reference Guide by Jason Piper. It has been a great resource for this assignment, and there is information, educational strategies, and accommodations for every conceivable exceptionality. I found the information on the American Association for Pediatric Ophthalmology and Strabismus extremely enlightening when researching the visual impairment exceptionality.
The World Health Organization website was loaded with facts and is a reliable source for such information. Healthline.com was another great resource for peer-reviewed medical articles for the research of this presentation, specifically an article called What You Need to Know About Blindness by Shishra Body.
The CNIB Deafblind Community Services website was a valuable place to find facts and stats and was very Canadian focused with their information. Kidshealth.org was also a great researching tool as it contained a multitude of articles full of medical information about the many causes of visual impairment.
Thank you for sticking with us. If you have any questions, please feel free to reach out to us.
Yes, thank you all. And don't forget to grab a copy of our handout for all of your educational needs.
Thanks, everyone. Please join the conversation on the discussion board where we'll be responding to posts all week.
Thanks for watching. I'd like to thank my group members for another great experience on this project. I hope you enjoyed our video presentation of visual impairment exceptionalities. We'll see you all next time.